Colorectal cancer is a collection of abnormal cells that arise within your colon and rectum. So the colon and rectum is the last part of your intestine, or sometimes called the large intestine. Changes can happen just naturally throughout time, and cells can become a little bit abnormal. Those abnormal cells turn into small things called polyps or abnormal growths, and then those growths can get more changes to them and to the point where it actually becomes cancer. One of the concerning things about colorectal cancer is there could be zero signs. It's really, really important to adhere to some of the guidelines for screening, which are now at the age of 45. We recommend getting some form of colorectal cancer screening, which usually the best test is a colonoscopy, and there's some other things out there as well. For people who do have signs or symptoms, the most common thing is probably bleeding from your bottom. Bleeding is not normal under any circumstance. Oftentimes it's attributed to hemorrhoids or something else, but you don't know that until it's actually checked out. So if you have any kind of bleeding or any kind of odd symptoms at all, get it looked at by your primary care physician and they can decide what the next steps could be. Some of the other signs and symptoms might be a change in your bowel habits, if you have trouble making your stools, if you're more constipated, or even if you have diarrhea, or anything that changes from what your norm has been. So about 5% of all colorectal cancers arise within some sort of what we call a hereditary syndrome, meaning that it runs in your family. It's inherited from mom or dad, and if they have it, a lot of times you have also a 50% chance of also getting it. We know there's a lot of different things that at least contribute to it. As a general rule, staying healthy, staying fit, exercising, having a normal BMI or body mass index, staying a normal weight, avoiding alcohol to excess, avoiding smoking, those are all some of the things that help us to have a normal, healthy life. The cure rate and success of treatment really depends on the stage. So the stage means where's the cancer gone? And earlier stage means it's usually confined just to the bowel wall itself. A little bit later stage, or something called a stage 3, is when if it goes to lymph nodes around the colon. And then if it spreads to other parts of your body, it's a stage 4. Ideally, you want to catch cancer when it's early. So stage 1, 2, and even 3 is very, very curable. Even stage 4 can be curable in the right situations. I'm very excited about opening up the Colorectal Cancer Center. It actually gives us an opportunity to put all of our resources kind of under one virtual roof and really put patients at the forefront of everything that we do. We've always provided great care here. What I think this will do mostly is get everyone in a much more coordinated fashion, trying to get people more timely care to get in to see all the specialties that are involved. There's discussions about each case between the different specialties about what the best thing is for that patient, what new research trials are going on, what new techniques are available, say in radiation or in surgery, what's the latest and greatest in immune therapy. All those things are going to be accessible to all these patients coming in.